It's West Tech's Wednesday, and Dr. Beck is here with some great advice. We're covering RSV today, so can you kind of break down what that is?
RSV stands for respiratory syncytial virus. It's a virus that mainly affects our younger population, our kiddos, and it can become quite serious, and we see it mostly in the wintertime, but it can occur other times, but primarily we see it in the wintertime.
And so, especially with the holiday season, a lot of people traveling, like, how is this something like bronchitis where it's contagious, or I don't know quite how this is transmitted?
Yes, RSV is very contagious, unlike bronchitis, which is really not contagious. I mean, it's still a good idea to cover your mouth when you cough, but RSV is very contagious, and so we'll see outbreaks of it, for instance, in daycares, because you got lots of kids running around, and despite the fact that we tell our children to cover their mouths, wash their hands, you know, in a daycare where we've got toddlers and infants, which is the age group that we typically see that it affects most seriously, it's kind of hard to have them wash their hands and cover their mouth when they're coughing. Yeah,
I know, that's hard, those kiddos. But too, you know, we've seen the flu has become deadly this year. Is this something that could be deadly as well to young children?
Rarely is it deadly. Most children are in older kiddos, if they're older than 2 years of age, it's more like a cold. I mean, adults and younger children can also get it, but the age population that we typically worry about it is in kiddos less than 2 years of age. And that's the population where it can really become serious. Basically, it affects the entire lung, and they can have high fever, a really severe cough, and they can get to the point where they actually have difficulty breathing. They have so many secretions, and it can cause some bronchoconstriction or constriction of the airways. Typically, we treat it with symptomatically. It's not a bacterial infection, so we don't treat it with antibiotics. We use medications to help dilate the bronchial tubes, other medicines to help dry the secretions up, but rarely is it deadly.
And what symptoms should parents be looking out for that might be also a little different from the common cold?
Yeah. Well, unfortunately, it's not always, especially early on, it's not a lot different than the common cold. They can have cough and fever and runny nose, which is exactly what you see with the common cold. Now, it is relatively easy to test for RSV. Again, we don't treat it with antibiotics, but we just do know, especially the very young children, we have to watch them very closely because it can get to where their oxygen levels get low and they might need to be hospitalized to help support their respiratory system with oxygen and other strong medications to help keep their lungs open.
I would think with kids also with asthma, that would be something to be cautious of, but are there ways to prevent this?
Main thing is good hygiene. I mean, once it happens, and we see it every winter, is, being able to, again, in young children, it's hard to tell them to wash their hands or cover their mouth, but you can still encourage that. But cleaning surfaces, because it's spread via respiratory droplets, it's spread via direct contact also. So cleaning areas and disinfecting areas to help reduce the load of the virus that causes the respiratory infection.
I always see those commercials where the kids come home and then they sanitize a lot of the stuff if there's been something going on. But if you do feel like your child has this, or you yourself, what should you do?
Like I said, in adults it's going to be really similar to a cold. We don't usually treat the RSV in adults with much, but in children, the younger children, we can test for that. It's a nasal swab, and we can do that in the office. Just takes 5 or 10 or 15 minutes to get the results back. And again, there are certain medications that we use to help support the respiratory system, but we don't treat with antibiotics because it's a viral infection.
Well, it's probably a good idea to tell kids that Santa wants you to cover your mouth and also wash your hands constantly.
Santa said.
Santa said. So where can we find you?
Yeah, we have 2 locations in Midland and soon to come in Odessa. You can look at our website, www.westtexurgentcare.com.
Awesome. Well, thank you so much, Dr. Beck, for being here and giving us that very vital information.